Colon cancer, also known as colorectal cancer, is a type of cancer that starts in the colon or rectum, which are part of the large intestine. It begins as small, benign growths called polyps, which over time can develop into cancer. It is the third most common cancer in both men and women. The colon, also known as the large intestine, is a vital organ in our digestive system. It absorbs water and electrolytes and eliminates waste from our bodies. However, sometimes cells in the colon can become abnormal and start to grow uncontrollably, forming a tumor. This is known as colon cancer. Colon cancer symptoms can include a change in bowel habits, such as constipation or diarrhea, blood in the stool, abdominal pain, fatigue, a feeling of fullness or discomfort in the abdomen, unexplained weight loss. It's important to note that these symptoms can also be caused by other conditions, such as inflammatory bowel disease or hemorrhoids. It is recommended to see a doctor if you experience any of these symptoms, especially if they persist. The exact cause of colon cancer is not entirely understood, but there are several known risk factors. Age. The risk of colon cancer increases as you get older. Most cases are found in people over the age of 50. Genetics. If you have a family history of colon cancer or polyps, you are at a higher risk. Inflammatory bowel diseases. If you have ulcerative colitis or Crohn's disease, you have a higher risk of colon cancer. Lifestyle factors. A diet high in red or processed meats, low in fruits and vegetables, and a sedentary lifestyle can increase the risk of colon cancer. Smoking and excessive alcohol consumption also increase the risk. It's important to note that not all people with risk factors will develop colon cancer. Regular screenings are important in detecting colon cancer early and improving the chances of successful treatment. Colon cancer is typically diagnosed through a combination of tests and procedures, including a stool test can detect blood in the stool, which can be an early sign of colon cancer. A colonoscopy, in which a long, flexible tube with a camera on the end is inserted into the rectum and used to examine the entire colon. During the procedure, any polyps or abnormal areas can be removed and biopsied. CT colonography, also known as a virtual colonoscopy, that uses a CT scanner to create detailed images of the colon and rectum. Flexible sigmoidoscopy, which is similar to colonoscopy but only examines the lower part of the colon. Double contrast barium enema, which involves injecting a contrast solution into the rectum, which allows the doctor to see the colon more clearly on an X-ray. Once a diagnosis of colon cancer has been made, further tests such as blood tests and imaging scans may be performed to determine the stage of the cancer and whether it has spread to other parts of the body. Colon cancer is typically staged using the TNM system, which stands for tumor, node, metastasis. The T, N, and M describe the size and location of the primary tumor and whether it has spread to nearby lymph nodes or other parts of the body. There are 4 stages of colon cancer. At stage 1, the cancer is limited to the innermost layer of the colon or rectum and has not spread to nearby lymph nodes or other parts of the body. At stage 2, the cancer has grown through the innermost layer of the colon or rectum and may have spread to nearby lymph nodes, but it has not spread to other parts of the body. At stage 3, the cancer has grown through the colon or rectum and has spread to nearby lymph nodes, but it has not yet spread to other parts of the body. At stage 4, the cancer has spread to other parts of the body, such as the liver, lungs, or distant lymph nodes. The treatment of colon cancer depends on several factors, including the stage of the cancer, the patient's overall health and preferences, as well as the specific characteristics of the tumor. The main treatment options for colon cancer are surgery, chemotherapy, radiation therapy, and targeted therapy. Surgery is the most common treatment for colon cancer. The type of surgery will depend on the stage of the cancer and the location of the tumor. Surgery to remove the cancerous part of the colon is called a colectomy. Chemotherapy uses drugs to destroy cancer cells. It may be given before or after surgery to shrink a tumor or to kill any remaining cancer cells. It can also be used to control the cancer progression in advanced stages of the disease. Radiation therapy uses high-energy radiation to kill cancer cells. It can be used to shrink a tumor before surgery, or to relieve symptoms caused by advanced cancer that has spread to other parts of the body. Targeted therapy uses drugs that target specific molecules involved in the growth and spread of cancer cells. These drugs can slow or stop the growth of cancer cells and may be used alone or in combination with chemotherapy or other treatments. After treatment, the patient will need to have regular checkups and screenings to monitor the cancer and check for recurrence. Colon cancer can be prevented to some extent by reducing your risk factors and by early detection. Some of the ways to prevent colon cancer include regular screenings such as colonoscopy for over 50 years old people, eating healthy diet, regular physical activity, maintaining a healthy weight, avoiding smoking and excessive alcohol consumption, and managing underlying conditions such as inflammatory bowel disease. It's important to note that even if you take all the necessary precautions, colon cancer cannot be completely prevented. Early detection and treatment are key to improve the chances of successful treatment.